Hello, my name is Dr. Brian Smith. I'm a chiropractic physician and a certified nutrition specialist. I've been successfully treating people with carpal tunnel syndrome for more than 20 years, and I'd like to explain to you a little bit about what carpal tunnel syndrome is and how it can be handled, how you can find out what is causing the problem so it can be successfully treated. Now, carpal tunnel syndrome symptoms are pain, numbness, or tingling in the first 3 digits of the hand. You also often have muscle weakness, and people will, in severe cases, will have wasting of the thenar muscle. This muscle will start to atrophy or get smaller because of the problem with the nerve. Now, true carpal tunnel syndrome is an entrapment of the median nerve at the wrist. Okay, right in here in the carpal tunnel. The median nerve is a nerve that starts in the neck, coming off of the nerve roots of C5 through T1. Now let's just show you. Median nerve begins in the neck, travels down the arm, through the shoulder, the arm, the elbow, the forearm, sends branches into those 3 fingers. Now, the problem with carpal tunnel syndrome is everybody, most orthopedists and neurologists, look at the carpal tunnel. They look there for the problem, and that's a major source of the problem. Chiropractors, on the other hand, tend to look at the neck and look for pinched nerves, which is another major cause of the problem. However, if you look at it, you can have a problem with that nerve anywhere along its course. So that problem can come from the spine, it can come from the muscles in the neck, shoulder, forearm, or wrist. So if you're just looking at the wrist and maybe the neck, you're missing a lot of places where there could be a potential problem causing the symptoms in these 3 fingers. Now, a major factor, which a lot of people overlook, is something we call double crush syndrome. With a double crush syndrome, we find problems in the wrist, but also in the neck at the same time. That usually comes if someone's been in an automobile accident or had a fall where they had their hands on the wheel or they had their hands out in front of them when they fell, and there was a trauma to the hand and wrist, injuring the wrist, but also the head was whipped, like in a whiplash, causing a problem in the wrist, in the neck. Quite often I see these people, they've gone for carpal tunnel syndrome surgery, and like the statistics show, 60% of the time, within 2 years, the pain comes back. Why? Because surgery only addressed the wrist and ignored the neck. Now, another thing that's really important and is often overlooked when dealing with this type of problem is that there's a branch of the median nerve that comes off of the main part of the nerve in the forearm. And it comes off in the forearm before that nerve goes through the carpal tunnel. However, that nerve still comes into the hand. So you'd be amazed at how many times I've seen people who've been diagnosed with carpal tunnel syndrome, but the main problem wasn't the wrist, the problem was the forearm, where that nerve branches off before it goes through the carpal tunnel. Treating their wrist might give them temporary relief, but until you treat the forearm in that situation, you're not going to get rid of the problem. There are more than just mechanical problems that can contribute to carpal tunnel syndrome. Hormone problems caused by menopause or by taking birth control pills can cause carpal tunnel syndrome, as well as thyroid hormone problems. Now, vitamin deficiencies, especially in vitamin B6, can cause carpal tunnel syndrome. If you are vitamin deficient, supplementing with the correct dose of vitamin B6 can do wonders for carpal tunnel syndrome. Now, if you have a methylation problem, and research suggests that more than 40% of us do, then you will have problems absorbing and utilizing B6. So the typical old garden variety B6 you get at Costco just won't do the trick. You'll need a methylated B6 to get results with your carpal tunnel syndrome. Blood sugar issues such as diabetes or insulin resistance can cause problems with the median nerve, leading to pain, numbness, and tingling in the hands and fingers. Adrenal gland and cortisol issues often go hand in hand with blood sugar problems and can often lead to inflammation, which is usually a major factor in carpal tunnel syndrome. So let me ask you, has any doctor even mentioned hormone imbalances as a source of your carpal tunnel syndrome? Has anyone discussed dietary modifications that can optimize your blood sugar, reduce inflammation in the body, and help get rid of your carpal tunnel syndrome? Have you ever been informed about the correct form and dose of B6 that might help your carpal tunnel? Or did they just look at your hand and wrist, maybe run an EMG, and decide physical therapy and surgery was the correct way to go? In my office, we'll not just check your wrist and your neck. We will check your wrist, your neck, your shoulder, your elbow, your forearm. We'll discuss hormone-related problems that might be contributing. We'll discuss the thyroid. We'll talk about vitamin supplementation. We'll even test to see if low-level laser therapy might be beneficial to handling your carpal tunnel syndrome. I'll leave no stone unturned to try to get to the bottom of what's causing your problem and customize a protocol specifically for you to help handle your carpal tunnel symptoms. Now, if you want to be treated as an individual who happens to have carpal tunnel syndrome instead of just a carpal tunnel diagnosis, if you don't want to be treated with a cookbook type, one-size-fits-all, recipe type treatment program, then please take the time, call my office, arrange a consultation, and we'll see if what we do can help you. I'm sure you'll be glad you did.